So we've reached the point in Canada where about half the people infected with COVID-19 got it from abroad or from someone who was traveling, and the other half got it through community transmission. And experts say this is a crucial point in this crisis, that we can either take more drastic measures now and flatten the curve, or not, and risk seeing the number of cases rise so fast that they become impossible to handle and thousands of people die in a very short period of time. So today seems like a good day to take a step back and ask ourselves, are we on the right track? Is the approach we're taking actually the best that we can do? And what do we need to mentally prepare ourselves for? Today, we've got André Picard on the show. He's a longtime health columnist with the Globe and Mail who's been a leading voice on the COVID-19 pandemic in Canada. From Global News, I'm Tamara Kandaker, and you're listening to Wait, There's More. André, hi, thank you so much for doing this.
Hello.
So where are we right now in Canada with this pandemic? We've all seen images of the curve that's either very steep or a bit flatter. Where are we right now on the curve? How would you describe it?
Right now, we're at about almost 3,500 cases and 36 deaths, I think is the latest that I saw. So it doesn't seem like a lot, but it just tells us that there's the potential for this to really take off. I think where we are is sort of at the bottom, and we don't know where it's going to go. So it's either going to keep going up sharply or it's going to flatten out. And we're really in a crucial moment now to figure out what the next few weeks is going to look like.
So you're saying that we're at the bottom of this curve, and you wrote in your column this week that we're at a tipping point. Can you just kind of unpack that for me? What did you mean by that?
Yeah, the tipping point is for a long time we were doing okay because all our cases were travel related. So people would come in from another country, we'd find out that they were infected and they'd be isolated. So that's, from a public health perspective, pretty easy to maintain. But now what we're seeing is quite widespread community acquired cases. And what that means is you can be walking around and you catch this virus from you don't know who. So that really makes it difficult to figure out where this is going. That becomes a whole different kind of epidemic to control for public health. And that's where we are now, where half our cases that we know of are community acquired. And when that happens, it also tells us that we have a lot more cases out there. So why are people randomly getting this? Because a lot of people have it.
Yeah, so this could potentially be wildly out of control, but we just don't know the numbers yet.
Right. So a lot of the research is suggesting that we have 5 to 10 times the cases that we know about. So if we have 3,500, we could have 35,000. Now, that's not necessarily a bad thing, because it probably means most of those cases are very mild, which would be a good thing. But it just has the potential there for a lot more people being infected quickly.
And I guess there's also the potential that a lot more people are going to get severely ill.
That's the big concern for our hospital system, is we don't want it to be overwhelmed by hospitalizations, and particularly by people in intensive care or critical care units where there are a very small number of beds.
We are generally at capacity in our critical care areas. If we have to move into overcapacity beds, that also means we're going to need more staff.
Not just nurses, but respiratory therapists to help with intubation and ventilator care.
And we know now, so we're starting to get semi-decent stats in Canada. So about 6% of cases are being hospitalized and about 2% are ending up in ICU. So again, that doesn't sound like a lot. It's not a lot, 2% of 3,500, but 2% of 35,000 is a lot. That would overwhelm our hospitals. So the question is, how can we minimize the worst cases?
So if we're at a tipping point right now, where could we go from here? Break down the two scenarios for me.
Well, there's really two ways to go. One is to go the way of Italy, which is we don't get control of this until too late, and our hospitals are overwhelmed. People are dying in hallways. We just don't have ventilators for them.
Italy's armed forces are having to work harder every day, transporting bodies out of the worst affected regions as the rate of death continues to increase.
there's massive numbers of deaths. So Italy is seeing thousands and thousands of people dying in a system with a really good medical system, really good health system, Western country, and it's totally overwhelmed. So that's the worst case scenario. The other alternative, the hopeful one, is that the social distancing we're doing, so staying away from people, stops the virus from propagating quickly, and that we continue to get this slow rise in cases so that 2% of people are in ICU. We can handle that. We can handle that over a long period of time. So this expression, flattening the curve, has become part of our lexicon now. What it means, it doesn't mean that people won't get infected, because this is a novel virus, we're all susceptible to it. It means they'll get infected more slowly so that we can handle the repercussions. This gives us the opportunity to buy time so we can get better treatments or we can develop a vaccine, etc. So the two scenarios are really this. Everything happens over 18 weeks, and that's really bad, or everything happens over 18 months or more, and that we can handle it.
So the next little while then is really make or break for us. And what do you think we should be focused on?
Well, we have to really focus strongly on social distancing. If you don't interact with people, you can't catch the virus. So that's really important. That won't work alone. In addition to that, we have to do testing. We have to figure out who is already infected, rein them in, get them isolated so they can't spread it to others. And then we have to, I think, do a better job of communication to explain to people why this stuff is so important, so we don't end up with, thousands of people on the beach saying, oh, it's not a big deal.
Okay, so the social distancing measures have already had a massive impact on our economy. So hundreds of thousands of people have lost their jobs already, and people are really scared.
I'm just hoping that they can bring some measures in to help us small businesses. I mean, especially in Whistler, as we're a tourist town, this is going to hit us incredibly hard.
So a lot of people are asking if this is actually necessary because there have been other options floated that don't involve shutting everything down. So you have places like South Korea, Hong Kong, and Singapore that have managed to contain the virus by sort of identifying infected people, isolating them, and then tracing all of their contacts. So why can't we do that here?
Well, I think theoretically we could do that, but it's very, very different cultures. So Singapore, Hong Kong, Taiwan are countries where they really follow the rules. When they did social distancing, there was there's no people wandering the street. That was that. End of story. The tracking, they did testing really to a massive degree. We just don't have that number of tests that they do. South Korea has done 250,000 tests before Canada had done 10,000. So they got an earlier jump. That's really important. And the other part of it is the civil liberties aspect. In a democracy here, people don't like this notion of what they did in Singapore, took everyone's phone, tracked everyone they had been in contact with via their phone.
If a user gets infected with COVID-19, he or she will be asked to give contact tracers access to the Trace Together data, a list of anonymized IDs that your phone has been close to. The anonymized IDs will help contact tracers quickly identify and contact people at high risk of infection to provide care and prevent the spread of the disease.
People would have a freak out here if we did this, to be honest. There would probably be court challenges. So I think there are practical cultural limitations. So we have to do these things, and we have to do them within our means and our abilities and our culture.
Say people were willing to kind of give up their civil liberties to do this and get it over with quickly. Is it too late at this point to try and track and trace everyone who's been infected and their contacts?
I don't think it's ever too late. We have to keep doing that, but I think it's getting difficult. The other thing that the Asian countries have had the advantage of is when they do something, they don't do it halfway. So we have a limitation on the number of public health employees we have. They had no limits. It's like you are going to do this and tens of thousands of people are going to do it at once. So again, it's a different way of operating a government.
So you mentioned testing, and the WHO has also said widespread testing is one of the key ways to get a handle on this thing. How would that help us at this point? And what is happening with testing in Canada right now? Why are we not doing it on a bigger scale yet?
So Canada has really picked up on testing in the last few days.
We have now tested close to 120,000 people in Canada, averaging about 10,000 people a day.
We're one of the countries that tests the most in the world. So I think we have to recognize that we've pulled up our socks on that. Now the question becomes, who do you test? So we've obsessed, I think, a bit about travelers. So we've really focused on travelers and testing them. And we don't have sort of these random tests in the community. And that's what we have to start doing now, is figuring out what's going on in the general population. How much infection is there? And I think we're going to start doing those studies. But when you talk about, everybody says, well, test everyone. Well, that's not going to happen. We're not going to test 36 million people. There's no point in that. We could use our money better. And the other thing is, you don't just test everyone who wants it, because then you are just testing the worried well. So we really have to focus on specific groups. And I think, travelers are one. We've probably over-tested them. But healthcare workers is really essential. Nursing homes, hospital patients who are not there for COVID-19, we have to figure out if they're infected, because that's who's going to die, is those at-risk populations. Indigenous communities, where there's a high risk if the virus gets in there. So we have to focus on those high-risk groups and then do some of this random testing. But when people get angry, I can't get my test, a lot of the times that's not appropriate. We don't need to do that. And the second part of testing is we're soon going to have a way of figuring out who's been exposed. So that's a whole different kind of test.
Are you talking about testing people for antibodies?
Yes. So there's antibody tests being developed, and that's going to be the next step, is to figure out, I'm a nurse, can I go to work? Well, we're going to do an antibody test. You've been exposed, you're immune, so yes, you can go back to work. And once we know that, it's going to change how we get back on track, how we get back to work. People who have been exposed will have immunity, so they'll be able to go back to their jobs. And that's how we're going to ease back into this in hopefully the weeks to come, if not the months to come.
Right. And I've heard that the UK is already sending these tests out to thousands of people.
So we've now bought 3.5 million antibody tests. That will allow people to see whether they have had the virus and are immune to it.
And the tests are going to be available at home, and they can tell you within 15 minutes if you have had the virus and you've recovered, and then you can just kind of go back to work. And the hope there also is that that's kind of going to help the economy go back to normal.
Yeah, and the UK has got a lot of attention for that. I think there's a fair amount of bombast in there. People are questioning the quality of that test. So I think we have to make sure these are really good tests before we do that. And I think for the UK has been a particularly unusual case. They were very slow. They decided they were going to do nothing, let everyone get immune, realized that was a disaster. And now they're sort of butt covering with this promise of doing this kind of test, I think.
And you mentioned that they were proposing initially this approach of getting everyone immune, and that seems to be what Donald Trump is now proposing.
I'm also hopeful to have Americans working again by that Easter, that beautiful Easter day.
So reopening the U.S. economy in 2 weeks while keeping an eye on the elderly and people who are especially vulnerable to complications from the virus. He's saying the cure cannot be worse than the disease.
But you're going to lose more people by putting a country into a massive recession or depression. You're going to lose people. You're going to have suicides by the thousands.
He's used the term herd immunity. Why can't we do that here?
We can do that, but it's really saying that we're going to allow a lot of people to die. And, it's writing off the elderly, it's writing off people with disabilities. I think it's a very cruel and unusual approach to public health, this notion that making money matters more than people. I think it's, beyond objectionable. But if you want to look at the science of it, that's the science of it. It's exactly what we talked about at the outset. A lot of people can get really sick now. We can have a massive disaster. And will we get back to work more quickly in that approach? I'm not sure. I'm not sure that an economy like Italy's is going to recover easily from this massive loss of life, massive loss of their medical infrastructure. Are people going to be rushing back to restaurants in Italy in a couple of weeks because everybody's immune? I seriously doubt it. So I think what's flawed with Donald Trump's plan, beyond the fact that it's ethically barbaric, I think what's wrong with it scientifically is it's making these assumptions that we're just going to magically get back to what we were doing before. And I don't think that's true in either scenario. I think we're going to have this new normal, and what we have to try and do now is figure out how to do things better. How are we going to rejig our economy so it's better than it was before? How are we going to rebuild our medical system so we don't have another one of these disastrous pandemics? So there's a lot of opportunity here that we're going to take advantage of once we deal with the immediate crisis, hopefully.
And just one more thing on the US's plan, and this is something that Boris Johnson was talking about too. It's this idea of isolating the elderly and the vulnerable. And is that practical? Is that something that would actually work if it was done perfectly? Like if we could isolate the elderly and the people who are the most vulnerable to complications from this virus?
Yeah, so that's an approach that's been floated a couple of places. Yeah, we could isolate the elderly, but for how long? Do you do it forever? That's one difficulty with that. Do we just take old people and lock them up in homes forever once they get to 65 or 70 or whatever the cutoff is? So I think that's a questionable approach. Do you keep their grandchildren from ever seeing them again? How do you operate that? And then the second part of it is that's based on this assumption that young people magically don't get sick. And again, we know that that's not true. We know that young children seem to have mild cases. But if you go to hospitals, you go to hospital in Toronto now, there's 20-year-olds on ventilators, and we're a country that's not hard hit yet. If you look at the age distribution, everybody gets sick, or at least gets infected. There are larger numbers of deaths in the elderly, which is understandable, but the rates of illness are about the same regardless of age. So it's this subtle difference that if mortality is the only measure and you're willing to write off everyone over 80, yeah, they're going to die anyhow, forget about them, then Trump's plan is a good one for you. But if you are not willing to sacrifice a large number of people being very ill over a long period, and again, we don't know what the long-term consequences of this are going to be. I was looking at SARS data the other day. A third, almost a half of people who survive SARS have long-term disabilities. These are not minor conditions that are inflicted on you.
Our approach as a country right now seems to be hoping that most people will stay at home and then shutting down businesses and public spaces to help with that. And then obviously the mandatory quarantine of travelers, which just kicked in last night. So this approach of hoping that most people will follow the rules and then shutting down businesses and public spaces to help with social distancing, is that approach working?
I don't think we know yet if it's working. I think it's the most practical approach that we can take in Canada. Again, we're not China. We can't, or we shouldn't send troops out into the streets. China literally locked people in their homes in large numbers to keep them from going out. I hope that we don't go to the point where that's what our civil liberties come to. I think we have to put a lot of trust in individuals to do the right thing. I think most people will. And then we have to use the powers we have, the threats that premiers and the prime minister have been making in recent days about, you're going to be in trouble if you don't follow the rules. I think we have to crack down on the few who don't do it voluntarily.
And do you think that the measures that are in place right now, if we put the trust in individuals and people actually follow the rules, the measures that are in place right now, are they enough? Like, is this enough of a lockdown for it to be effective?
It depends. First of all, there's a real lack of clarity of what the lockdown is. There's way too many variances between provinces and cities. There's a lot of lack of clarity of the rules. I think we should have already invoked the Emergencies Act and been clear about these are the rules everywhere, coast to coast to coast, and this is how they should be enforced. I think that would make it easier for Canadians to respect the law and to do the right thing. So I think that's the first thing, get our act together politically. And then, is it enough? We don't know. I think this, if you look at what's shut down and what's open, there's a lot of arbitrariness there. We could probably lock it down a little stronger if we want this to last less long. So everything's always about finding a balance. How long can we endure this stuff? The tougher the rules are, the shorter they have to be in place.
Yeah, and some of the other things that we could do, and I just wanted to quickly get your take on them. Other countries have locked down public transportation, for example. That hasn't happened here. Do you think that would help?
I think we really have to ensure that we have things like public transportation, because we do have a lot of essential workers. We have to get our medical professionals to work. We have to get grocery store clerks there. We have to have people in our pharmacies. The water has to operate, the electricity. All this infrastructure is really essential. There's sort of a paradox in Canada. Everything looks fine. Everything's operating as normal, which is great. That's really essential. But the other part of it is, at the same time, we're supposed to lock ourselves down. So we have to, again, find that balance between making sure everything's running and making sure that people don't go out and about and spread the illness.
And what about on an individual level? Do you think we need to start being more strict with ourselves about when we go outside? Recently, you wrote that ethically, you could argue that we shouldn't even be going on walks.
Yeah, again, it's a hard one. It's a hard one. We're all going to lose our minds if we never leave the house. So it'd be great if everyone could take a walk every day. It's fine if we all go for a walk, but it's not fine if we all end up on the same beach, right? So it's finding what's the way we can all get out there and get fresh air, which is good for us, good for our mental health, but not spread the illness. Again, you have to control how many people go into a grocery store, how do they line up? And we don't have that stuff quite right. I think a lot of businesses are struggling with this. They could do with some practical advice. I was at a grocery store last night and thinking that, I wish public health would come in here and just show them how to put tape marks on the, on the aisle so that people weren't up against each other. So little stuff like that. We've got to help people out, especially those who are giving us essential services like grocery.
We'll be right back. A lot of people are worried about their jobs and being able to pay rent. They don't want their lives to be put on hold. And I wonder what you would say to those people.
I think we really have to have a lot of compassion and sympathy, and we have to really put a lot of effort into bailing out people. But I think our bailout programs have to be about helping individuals and not corporations. So I think that's what I would tell people. The government should be there and will be there for you, but it's about short-term pain for long-term gain. So you may lose your job for a couple of months, but the alternative is you may never have your job again if we have this much larger collapse like we're seeing in Italy. Life is all about trade-offs, and this is one that we have to make some personal sacrifices, and hopefully they'll be in the short term and not in the long term.
Yeah. And if things continue the way that they're going right now, and we have these guidelines that are fairly loose and, some of us are following and other people are not following as strictly, how long do you think this could go on for? And how long do we mentally prepare ourselves for?
Yeah, there's all kinds of estimates, from weeks to months. But I think we have to just focus on the next 2-3 weeks to figure out how much of an impact we're having. And then we can have, I think, a much better idea of what the longer term looks like. But I don't think we can keep our foot on the gas forever. We can't lock people down for an indefinite period. But, even China did it for 2, almost 3 months. That's not the end of the world.
Okay, Andre, thank you so much for all your work on this and for your very clear-eyed perspective. We really appreciate it.
Okay, well, thanks. It was nice chatting.
All right, that's the show. Thanks so much for listening. I'm Tamara Kendacker, and I'll talk to you tomorrow.